Welcome to another insightful episode of Me and My Health Up. The purpose of this podcast is to enhance and enlighten the well-being of others. I'm your host, Anthony Harcher. I'm a clinical nutritionist and lifestyle medicine specialist. This episode is on supercharging mental and digestive health with one of Sydney's most eligible bachelors, Samuel Minkin. How you doing, mate?
Yeah, really good. A real pleasure to come into the podcast today.
Great to have you on. Sam specialises in musculoskeletal therapy. He's one of very few practitioners who uses a non-invasive technique that stimulates the vagus nerve. It's a modern medicine technique which he sees commonly treating signs and symptoms of depression, anxiety, neuroplasticity, inflammatory disorders, irregular heartbeats, PTSD, reflux, and much more. So we're going to chat a lot more about this and what the work he does around the vagus nerve. Samuel's also one of very few experts in his field that is trained in Photobiomodulation, an exciting field of modern medicine which can regenerate tissue. So Sam's cutting edge therapist in the musculoskeletal space. So g'day again, Sam, and tell us a little bit more about yourself.
So basically, I'm a musculoskeletal therapist. I first started as a personal trainer, and then I did a diploma of fitness where I was working with clients with moderate risk, whether it be cardiorespiratory diseases, neurological diseases, and musculoskeletal conditions. And through that, I found it very interesting. I really liked the musculoskeletal side, and somewhere along the way, I ended up working in sports medicine. So I was the person who would run out into the field and I'd be holding people's legs together if they've snapped their leg in half. I'd be holding their neck, trying to control bleeding. And I did this for about 8 years. And about halfway through my sports medicine career, I met another sports medicine practitioner who was telling me about musculoskeletal therapy degree. Oh, that's a bit interesting. And he sort of explained how it not only looks at the musculoskeletal system, but it's also assessing things like biochemistry in the body, lifestyle, how the sleep affects pain. I thought, that sounds great. I went to the open day, and when I went to the open day, I was just blown away by how in depth it was. It was very evidence-based, and it just made sense. So I decided to do that. And it wasn't until my very last year of the degree that it just clicked, and I was like, this is what I want to do. And I fully fell in love with the profession and what I was able to do and the information I had learnt. So if we fast forward a bit, working in clinical practice as a musculoskeletal therapist, I started to notice that a lot of people with chronic pain had other comorbidities, things like major depressive disorder. And what I knew from neuroscience was that people's chronic pain causes their depression. But their depression increases their pain, and then their pain increases their depression, and there's this big snowball effect. And it made sense to me as the clinician that if I'm there to help treat someone's chronic pain, and I know that their depression is also increasing their pain, then it's probably something I need to look into and try and address. So this is how I found out about the vagus nerve. So for those of you who don't know, the vagus nerve is a nerve that essentially gets turned off by stress. And when people are in stressful situations, a lot of the time, this plays a large role in the exacerbation of their signs and symptoms.
And so what function does the vagus nerve facilitate within us?
So basically, the vagus nerve is the 10th cranial nerve, and it actually exits the cranium. So it comes outside of the skull. Now, the word vagus comes from the Latin word wandering, and it's because this nerve quite literally wanders down and throughout our body, particularly to all our vital organs. So 80% of the vagus nerve is sensory. So what it's doing is it's perceiving information, it's informing the brain, and then the brain is then making an appropriate change so that the body can stay in a state of equilibrium. Now, what is it measuring? Well, the vagus nerve is regulating your stomach acid. So if you've got too much stomach acid, it's going to pick that up, it's going to inform the brain, and then what we're going to have is a reduction in stomach acid because it's the appropriate outcome. What it's also doing is it's regulating peristalsis. So when you've got byproduct or stool in the intestines, it's regulating the speed of peristalsis. So if it's too fast, well, we're going to have diarrhea. If it's too slow, we're going to have constipation. But what I think is quite interesting is it's actually mediating histamine. So if you think about when you have hay fever and you take an antihistamine, and that alleviates the symptoms of that sensitivity, the vagus nerve is mediating the histamine within the body, particularly in the duodenum. So it just makes sense that when this thing isn't working, when the vagus nerve isn't working, we can have issues with our histamine regulation. We have issues with our digestive system, whether it be reflux or low stomach acid, or maybe we're constipated. And it's just a fascinating nerve, particularly for its ability to regulate our inflammation in our body systemically. So it's got so many profound effects, and we'll get into it a lot today.
Absolutely. I'm very excited because chronic stress is something I see commonly with my clientele, and I'm sure you do too, with the society we live in. And plus, given the situation, where we're still currently in, but, the whole COVID situation has only exacerbated stress for some people. So, that fight or flight response is certainly amped. And I'm really fascinated with this, this vagus nerve and so in terms of, you obviously work with it from a sort of mechanical point of view, whether that's the right terminology, I'm not sure, but you can correct me. How can listeners help switch on and activate their vagus nerve? Like what can listeners do in order to, you mentioned it improves digestion, it helps reduce inflammation, it helps mediate histamine. So is there any tips you can provide in terms of what they can do in order to keep it well toned or, active?
Well, one of the, I suppose the first thing that comes to mind is stress management.
Okay.
So trying to manage our stress. Now, if there's something that we know is going to be stressful, working out ways for that not to be as daunting. So it's not so confronting, and it doesn't really stress us out. And that's mainly because the vagus nerve is the main parasympathetic nerve in the body. And what you'll know is that you've got your sympathetic nervous system, which is your fight and flight nervous system. And this is when we're feeling quite stressed, quite anxious. And it's because the sympathetic nervous system is a system that is there in place in the event that we are getting chased by a tiger. And we need to run away from this tiger to basically conserve our life. Or it's also there if we feel like we can't run away, we need to defend ourselves, we need to somehow wrestle the tiger. It's there to help us with this. And it's a really great system. It's important, but it's only needed in those sort of life-threatening moments. And the problem is there are people, and a lot of people, who aren't necessarily in those situations, but their body feels like it's appropriate to have that response. And this isn't good. This is where, we get really run down. And with chronic stress, it just falls into like chronic fatigue, and our body just starts to fall apart because it can't stay in that system forever. It's only there for short bursts. Now, what all that means is your sympathetic nervous system turns off your parasympathetic nervous system. It's kind of like a seesaw. So you're feeling stressed, you're feeling relaxed. You can't be both at the same time. So sympathetic nervous system is turning off parasympathetic. The parasympathetic quite literally is your vagus nerve. So things like stress are turning the vagus nerve off. And what's interesting is they found clinically that 3 weeks or more of stress, something occurs in the body called gene transcription. And the body starts inserting what's called inhibitory receptors along the vagus nerve. And all these inhibitory receptors conceive messages of inhibition, because the way receptors sort of work is like a lock and key. So if you've got a triangular shaped receptor, it's only going to accept triangular shaped shapes. So if you've got a whole bunch of off receptors, it's only going to perceive off signals. And what this whole process that occurs due to the chronic stress means is that we get stuck in a sympathetic state. And even when we're not in that running from a tiger situation, maybe we're at the beach with our family, maybe we're just taking a nice drive to work, we feel quite overwhelmed, we're quite stressed, we're very reactive. And we also can just respond, in ways that aren't really our true selves. And that can really stress us out as well.
Yeah, I'm fascinated with how you said it's chronically, switched on or chronically activated, and you need the right shape in order to turn it off, so to speak. And you mentioned that stress management is key, to help the vagus nerve in its function. So if someone has been chronically stressed for 3 weeks, and it's that vagus nerve is switched off, is there any way stress management can help them get it back active again? Or is it something where you do need a bit of support? And we'll get into what you do with the vagus nerve, but what are you seeing with your clients, if it's if they have very low vagal tone?
So in regards to that, so you primarily try and reduce your stresses, but there's other exercises we can do that actually utilize the motor output to the vagus nerve. So as I said previously, 80% of the vagus nerve is sensory, and then there's the rest of the percentage which is motor, so it has the ability to do contractile things. So the vagus nerve actually supplies the uvula, so it's the dangly thing in your throat, and the soft palate. And the actual elevating of that, so you might have been to the doctor before and they put up like a stick in your mouth, a tongue depressor, they get you to go, ah. Now, what they're actually looking for is the lifting of the uvula. Now, that's something I also assess clinically to get an idea of where someone's vagus nerve status is. So what that means is if you can voluntarily contract it, you can exercise it. And the way we do it is gargling. So just gargling water and trying to accumulate 2 minutes of a morning, 2 minutes at lunch, and 2 minutes in the afternoon or night. And you don't have to do 2 minutes in one go. It's quite hard. A lot of my patients who don't realize that they've got issues with gargling, they can only gargle for 5 or 6 seconds and they have to spit it out. They're like, oh, it's really hard. Or they might even find that they don't have the strength to gargle. They never realized. And they get the water traveling down their throat. They can't actually occlude the back of their throat because they've got such low vagal tone and such low strength that when they do try and gargle, it doesn't stay there. It goes in their throat, they're coughing. And that's actually quite a severe symptom. Other symptoms are things like when they drink water, if it starts coming out their nose, they can't occlude it correctly. Had another patient who I asked him that, does water come out your nose? Did a few vagal nerve tests. And I was like, I'm a bit unsure. Like, it's definitely a vagus nerve issue. And then he said, oh, well, he can't swim. I said, well, why can't you swim? He said, well, as soon as I go underwater, the water pushes straight through my nostrils and down my throat. I can't occlude that. And I'm like, well, there you go. And he had quite severe digestive issues. But mainly exercises like gargling. And that's pretty good for digestive complaints. But there's another exercise which is a bit better for if you're feeling stressed or bringing you into more of a parasympathetic state. And it's called a mammalian diver's reflex. So a mammalian diver's reflex is a reflex they first noted in dolphins. As they breach the water, as they come back into the water, the cold water pressure along their snout and face, what happens is it drops their heart rate quite low so they can conserve their oxygen to stay in the water longer. Scientists then realize, well, us as humans are also mammals and we also have the same reflex. So the way we would do it is we would get a bowl of ice water, we'd submerge our face in it, and just for 20 seconds, and come out, have a bit of a breather. When you're ready, do that again. And we want to do that 4 to 6 times. And what you'll notice is that your heart rate will go up by about 10 beats a minute initially. Then it will drop by a beat every second until it comes down to about 42. So if you're feeling quite anxious or you're feeling like you may be on the verge of having a panic attack, if you can bring your heart rate down to 42 beats a minute, you're feeling quite relaxed. You're feeling a lot more in control. And this works via the vagus nerve, of course.
So it'd be a great tip for public speakers to have an ice bath handy and to do a few dunks and, really calm themselves and get them in the zone. Yeah, so that were great tips, like the gargling, the ice, the cold water on your face. And that cold water on the face is, something that it's like a bit of like an old wives' tale in order to wake you up. But, I guess that more severe way of doing it with ice, for example, then takes you into that more relaxed state. Yeah, that's great. I really enjoyed those tips. Now, in terms of the work you do with the vagus nerve, obviously you shared some tips that the clients can do, and in terms of, well, first of all, how you assess it to see whether they have good vagal tone, and then secondly, some take-home exercises, what they can do at home. What do you do in clinic to support people with low vagal tone?
Okay, so after they come in for a consult and I do my assessment, I actually ascertain in the consultation whether it's a left or a right vagus nerve issue. Because you've got two vagus nerves, one either side of your neck. Your left side is controlling digestion. Your right side is more the rhythm of the heart and more correlated with mental health stuff, like issues with sleep, issues with anxiety. So through the assessment, I'll work out which side needs more help. And then dependent on that, I use something called a transcutaneous irregular vagus nerve stimulating machine that I've actually built and programmed. It actually looks like this. So this machine I've got here, I've got these clips, and I put these clips on the ears, and I put them in a particular part of the ear where the skin supply is innervated by the vagus nerve. Now, once I've done that, I'll select a particular frequency or treatment protocol that's appropriate to their condition. So with vagus nerve stimulation, non-invasively, there is a variety of different frequencies, and they do completely different things. For instance, let's say I've got a patient with, let's say they've got really low peristaltic activity and they're feeling quite constipated. I'll get my stethoscope and I'll have a listen to their ileocecal valve. So I'll listen to the quality of sounds, the frequency of sounds, and then I'll put the stimulation on, and I'll put it on a particular frequency that I know works for digestion, particularly peristalsis. I'll give them a couple of minutes and I'll just start to monitor it. And what I begin to notice, usually around the 8 to 10 minute mark, is that there's an increase in sounds. So it really does depend on their condition to what frequency I use, but that's primarily what I'm doing. I'm also assessing whether mechanically the vagus nerve has been irritated or damaged. And a lot of the time this happens from things like whiplash injury. So people involved in whiplash injury or anything in the sort of upper cervical. Now, nerves, you should be able to touch and palpate nerves without it being painful. And if you do touch nerves and palpate nerves and they feel bruised and very sensitive, well, this isn't a normal finding, and it indicates that that nerve itself is irritated. So I'll palpate the vagus nerve on both sides, and a lot of the time, if they've been involved in whiplash injury, throughout the vagus nerve, when I'm palpating, it feels quite tender. And it might just be one side that's tender. And more often than not, the side that's tender matches up to the symptoms that they're reporting. So palpating the left side, they're reporting things like reflux. They're reporting things like bloating, a lot of food sensitivities. But if it's their right side that's more tender, they're explaining to me that they're having issues getting to sleep, staying asleep. They've got issues with anxiety. They've got issues with depression.
Okay, so once you ascertain whether it's left or right, how does it change the course of how you work with the client?
Okay, so whether it's left or right, I'll still do stimulation on both ears, just because it's better to, a lot of the time, one side of the vagus nerve needs more support than the other, but that other side still needs a bit of support. So what happens is when I'm doing the stimulation with the machine, I've got some numbers on here. As I'm turning it up, those numbers represent the intensity. And basically the higher the intensity that I have to have with the machine, that indicates that the skin is less sensitive and it's not very good at picking up messages. Now, if we remember that the skin supply is supplied with the vagus nerve, then if the number is higher, then it means that it's not perceiving sensation very well. So a lot of the time I'll find someone and their right ear, they'll be suffering from anxiety, depression. Their right ear will be like 12, and that's just intensity. And their left ear will be something like 8. Well, 8 is still a very high number. You know, I should be expecting numbers around 4. So I still treat both sides, and it's just to treat both sides really, because you've got them there, you might as well treat both sides.
Yeah, I totally understand. And I think listeners would be thinking, and viewers at the moment, is this something that's, as much as it's non-invasive, but it's electrical signal, is it painful, or does it create any tingling sensation? What would clients experience yeah?
So what they found is that when you're doing the vagus nerve stimulation on the ears, it doesn't have to be high. In fact, they've done a few studies where they turn the machine up to where the person feels it, and then they just turned it down enough that they just can't feel it. And it had the same effect. So it still had the same result. However, when they were doing treatments for stroke, with stroke rehabilitation, they found that having it a bit higher, a higher intensity, and coupling that with a desired movement in which they may be having trouble with, had better effects for motor recruitment. But we were treating things like anxiety, depression, treating things like digestive issues. No, it feels like a mild buzz. It can always feel like the ear's vibrating, or a lot of people say that it feels like the clip's falling off, but it's not. So it's not a painful thing. Research first begun on vagus nerve stimulation back in 1987. And since the research first begun, there's been no adverse effects or basically side effects from the stimulation. The only thing they found in very rare cases was some people's voice became a little bit more hoarse that day, but it dissipated by the end of the day, but there were no negative outcomes. So it's a very safe therapy. It's very easily sort of administered onto a person, and there really isn't any contraindications to its use, apart from if you do have a pacemaker. It's recommended that you just run it past your cardiologist first, and more often than not, there isn't going to be an issue. But it's just always good to mention any new therapies, particularly anything electrical, to your cardiologist if you are fitted with a pacemaker.
Excellent point. Just on the therapy, and I know it's going to be a bit of a case-by-case basis, but you mentioned that client that came to see you with constipation, and you're able to improve their peristalsis, pretty much after, I think you mentioned, was it 8 seconds, or applying the vagus nerve machine. So you can get quite immediate effects in terms of whether it be digestive issues. Some of these more chronic conditions, such as generalized anxiety disorder, severe depression, PTSD, how roughly, maybe share some client success stories whilst you answer it.
It might be quite surprising, but it's pretty quick. The therapy works quite quick. So in regards to like anxiety, I find that people feel less anxious and very relaxed about 12 minutes into the therapy. Now, the duration of the benefit depends on the level of vagal tone. So let's say that you've got very low vagal tone. I do vagus nerve stimulation to really bring you into parasympathetic. During the treatment itself, you'll feel quite relaxed about 12 minutes in and onwards. And it may last the rest of that day, and then the next day you might find that I'm starting to feel a little bit anxious again. But then the next time you do the therapy, because you're not starting from this level of vagal tone, you're starting from here, it lasts longer. So then it's like, I'm actually getting 2 or 3 days relief. Now, in all honesty, when I'm seeing patients with anxiety. Generally, it's a whole week of relief the first time I treat them. There are only very few cases that, people who are very highly triggered, quite a lot of PTSD, where they're only getting 1 to 2 days benefit the first time they get the stimulation. The second time, it's increasing because it's just, the same effects carry over into digestive system. We might find that someone who has had constipation for 25 years and basically, they're on really high prescription laxatives and they can't really go further than what they are on, they'll find that, they'll have increased bowel motions for about a day and a half the first time. And then the next time they come, it lasts a bit longer. So what we're looking for in the therapy is that with every time I do the stimulation, is the duration increasing or is the quality of the improvement increasing as well? So it usually takes about that. So it's really just vagal tone. It's about getting the tone of the nerve up, because this isn't the therapy that you need to do for the rest of your life. What it is you've got a nerve that's been inhibited and has very low function, and you're doing a light electrical current on the skin just to sort of boost its activity. And once the activity of the vagus nerve basically increases to an adequate level, it's really about momentum. It'll continue to go, but you're essentially trying to jumpstart it and just get it working. Once it starts to perceive things, it gets stronger. So just like the chronic stress, which inhibits the vagus nerve, causes inhibitory receptors to form, and then the nerve gets sort of turned off more often than not. If you start to excite the nerve more, then you start to get more excitatory receptors. Then the vagus nerve finds it easier to turn on. Just needs sort of consistent level of tone, and then changes occur, and then it starts to work.
In the worst case, like in terms of most severe damage or most severe down-regulated vagus tone that you've come across, how long did that client, wait? And I guess how many, treatments did they have per week, and roughly what duration were you working with them until you really got to that real consistent stage where they were off on their own, being able to function without, constant support?
Well, it all depends if we're talking about vagus nerve trauma or damage as a result of food poisoning, or if we're talking about it in relation to, let's say, a thyroidectomy where they're removing the thyroid and there's a complication where they've either clipped the vagus nerve or they've dissected it accidentally. It really does depend. Because you've got two vagus nerves, even if they do cut one of the nerves, there has to be a crossover, because we're still seeing benefits of the opposing side. Really, a lot of people I see, it's twice a week for the first 2 weeks. And that's just, I really think that's a really good way of, so if you get the vagal tone up, and if it does start to drop off after 2 or 3 days, you're there to meet it again with some stimulation. And once you do that for 2 weeks, you're already seeing the benefits and the effects of it within the 2 weeks. And that's what we want to do. We want to see that the therapy works first, that we're getting the benefits, and then we can spread it out to once a week. But let's say worst case scenario, I had a patient who for 6 months, she was only able to get about an hour and a half of sleep a night. Now, she literally had psychosis. She had enlisted in the help of a few other health practitioners, and they declined just because she was a very unstable person, and it was difficult. The problem is she had such sleep deprivation that she couldn't tell the difference between being awake, being asleep. I recommended to her that she come to see me every day for a week, and we did the stimulation. And at the end of that week, she was getting 5 hours of sleep a night. And by sort of 2.5 weeks in, we're hitting the 7 hours a week of sleep. And once she started sleeping, she started actually having she started sort of looking back on how she behaved and events that had happened. And she was quite shocked that she couldn't see a problem with what had happened and how she'd got in a particular sort of state of mind. And even this particular patient, for instance, had she was involved in a sexual harassment case at work, and it essentially was because she was so sleep deprived. She she was inviting one of her colleagues over for wine. They were hanging out a lot, and she didn't see that as a problem, and it might not have been a problem. But then she was also sort of, they would cuddle up on the couch, and she honestly couldn't see how, cuddling up and having wine with a colleague may have made him think that she might be interested and there might be a relationship forming. Nothing of any sexual assault occurred, but he did make a move, and he was like, I suppose he went in for a kiss, and she declined, and she wasn't sure how weeks of hanging out had evolved into that, and just because she really couldn't tell. Her appropriateness of situations was quite far gone. She was very highly strung, extremely stressed, but when she started sleeping, she started realizing this is why I like to help people, because there are people who, they honestly just need a bit of help, and if they're trying to get help and people won't help them, how are they supposed to get better? I think every patient's got the right to healthcare without judgment, and people, no one wants to be sick. Everyone wants to be well.
It's a really great success story. So well done. And I'm sure the client's so happy. I was just thinking in relation, because, you've worked with Olympians and, high performing athletes. So you've done a lot of work with them. You understand the training intensity they're under, the workload, their aspirations, and their, just stop, or do anything to achieve, I guess, their ultimate dream. I was thinking, from a physiological point of view, that their body would be in chronic stress, from the training load. And I'm just thinking how you work with athletes from this point of view to really help maximize their recovery. Because at the start you mentioned that, by stimulating the vagus nerve, it helps with lowering inflammation. It helps with digestion, so therefore it helps with the assimilation of nutrients, can lower heart rate. So I can see it being really good for recovery. So just for those endurance athletes out there that are listening, watching, how do you work with them in terms of enhancing, I guess, their recovery between sessions and ultimately helping them achieve their dream?
Well, what I tend to see with these professional athletes is that when they do come to me, they've got an injury, whether it be an ankle sprain, but they're not recovering from this ankle sprain. It's sort of a grade 1 sprain, and a month and a half onwards, they're still having quite a lot of pain. It's not really healing. And if we bring it back to the role of the parasympathetic nervous system, it's all about resting, digesting, but also recovering and healing. So when someone has an injury of a sporting nature, if they're stuck in a sympathetic state, their body doesn't try and repair the injury. They don't recover from things. And it comes back to the same situation where prioritize. If you're running from a tiger, your body won't prioritize trying to recover a ligament in that particular instance, because it's trying to get away from a tiger to save its life. So if your body is not prioritizing a ligament sprain or a rotator cuff tear, then it won't. And we see these quite minor or even significant injuries that take much longer duration. And any sort of professional athlete can appreciate every day away from training really every day off is like 3 days off. So when you have 2 weeks off, you've actually had 3 weeks off. So, as fast as you can get back into training, it's most important. And that's what I have had. I had a gymnastics athlete who needed to compete in China, and they had to compete in 3 weeks. And they're battling this ankle injury that they've had for ages. And just talking to them, taking case history, they're highly stressed. They've been highly stressed. And it's not just their sport that had them stressed. They had other family stuff going on that was stressing them out. So it's okay, well, first and foremost, we need to bring you into parasympathetic. They were already reporting that they weren't sleeping very well. I'm thinking, well, if you're not sleeping, how is your body getting a chance to do anything? So I did some vagus nerve stimulation. I also used some other mechanical stuff like laser. Did photobiomodulation to the ligament, to the nerve supply that supplies the ligament, but then also the lymphatic sort of system, trying to help with the swelling. that was still laying there.
And I'm thinking there's athletes out there that are thinking, yeah, okay, I can come and see you if I'm injured, but and I'm thinking, have you come across any studies in relation to this? If athletes were to see you on that preventative and, seeking optimal recovery so that they can train more and get ahead of their competition. So is there any studies that you've seen in terms of it accelerating recovery between training sessions?
Would only be in regards to regulating inflammation. Yeah, so in regards to regulating the inflammation.
Okay.
In regards
Okay.
to vagus nerve, if we were to carry it over into photobiomodulation, which is otherwise known as laser, there are things you can do like lasering the bone marrow in the tibias and the sternum. They found that doing photobiomodulation to the bone marrow spikes mesenchymal stem cell production by 500%. So, when you've got these circulating stem cells and they're finding things that they need to recover, they sort of just like, yeah, there we go, and they start recovering things. But then there's cardiorespiratory endurance. They found that doing laser sublingually under the tongue increased cardiorespiratory endurance by 30%. So there's a lot of sort of ways that we can sort of hack the body and support it to perform at its best.
Fantastic. I'm thinking we'll have a separate episode on the photobiomodulation or the laser therapy because you've got so much wealth of knowledge, and I'm sure there's lots to share on that topic in itself. So we'll certainly leave that for another time. But yeah, I'm sure there's listeners out there and people watching this video that are really keen to say, well, how can I connect with Sam? I'd like to use his services. So how can people reach out and connect with you?
Easiest way is I've got a website, which is www.recuperatehealthandwellbeing.com. Recuperate is spelled RECUPERATE. A lot of people spell it with the double O. RECUPERATE.
And I'll include it in the show notes. A direct link so they can connect with you. Just on a more lighter note, I know you have a real fun side. You love skateboarding. You love being near the beach, swimming, snorkeling. You recently competed in the Channel 10's Bachelorette episodes, and I'm sure there's probably some listeners and viewers that saw you there. Just give us some insight of what it's like to be, I guess, in a situation where you're with others. It's like a bit of a competition, so to speak, to win the heart of a lady. How was it? And was it, because, people I've heard that have done things like the block and stuff like that find it exhausting because of the load or stress they put you under, just because they want to bring out the emotion. They want to actually get you into that fight or flight, and so that you become really emotional, and that's entertaining on TV, supposedly. But tell us what it's like.
Well, luckily enough for myself, I actually brought a Vagus Nerve machine with me. So due to this year there being COVID-19, we had to do like isolation. So I didn't see anyone. We were stuck in basically an apartment. And in that period, I was doing vagus nerve stimulation. I was meditating. I was making sure that when I was cooking, I was getting good food, because I wanted to make sure that, I was a bit nervous. I thought, like, honestly, I hadn't seen the show too much, so I didn't really know what to expect. I kind of went into it a bit blind. And what I did know is that I was going to be getting out of a limousine, walking down a red carpet, and then there'd be a girl there who I would greet and potentially form a very strong bond with. So I wasn't sure how that was going to go. So I was doing simulation in preparation for that. And how was it? Well, I got out of the limousine and there were two girls. So that just spun me. I wasn't sure what to do. But how did I find it? Look, it can be quite difficult because there's a lot going on. There's a lot of energies. There was, 20 or so other guys fighting for these girls' hearts, and all different personalities. So it did take a bit of energy, and I can guarantee you are quite tired at the end of each day. But I can attribute a lot of my sort of emotional regulation and my preparation to doing the vagus nerve stimulation. But it was very fun. I had a really good time. The girls are really nice girls. And I wish them all the best. I'm so happy that they've since found love and are enjoying their life at the moment. And I'm even mates with a lot of the fellas now. A lot of the fellas from the show. We were talking a lot about, I'm from Bondi. A few of the other guys were from Bondi, and we got talking, and a lot of them have actually moved over here. We've got 2 people who moved over from Perth, and now they're living in what's called the Batchy Pad, which is at the bottom of my street. So I see the guys all the time.
That's great that you developed such great mateship out of a really competitive situation that could have been, sort of a dog eat bone sort of animosity. But yeah, it's great that you've bonded and become friends afterwards, and you had that competitive edge in terms of down regulating that stress and really bringing out the best in yourself in terms of executive function and clarity of thinking and just being relaxed. And I heard that you're probably one of the most funniest on the show. So yeah, for those that haven't seen Sam in his zone, or you can watch it. I'm sure it's on the channel. Yeah,
10 Play.
10 Play. Yeah, so get on to 10 Play and watch. What series was it that you were in?
I was in season 6 of the
season 6. Okay. Awesome, mate. I really appreciate your time, your wealth of knowledge. You're top of your game in this area. And yeah, I'd love to have you on for another episode and we can talk about photobiomodulation and really get into the depths of that. But, I really appreciate the time you've put aside in your busy practice to really help the listeners and viewers. So thank you so much. And for the listeners, if you like this episode, please share it amongst others that could also benefit. As Sam mentioned at the start of the episode, people suffering anxiety, chronic anxiety, depression, PTSD, digestive issues, chronic constipation, chronic sleeping disorders. These are all the things that Sam is the expert at, and come to him, get a second opinion, and I know he gets great results with his clients. So well done, Sam, and thank you again.
Thank you. It was a pleasure.
You're welcome.